our public hearing on Senate Bill 549. And I would love to have Senator Sollman come up and Doug. And while they're coming up, Lisa, would you tell us what this bill does?
Thank you, Mr. Chair, members of the committee. Senate Bill 549 has a -1 amendment, which replaces the measure. That amendment establishes a minimum amount for grants to school-based health centers. It establishes a couple of other grant programs and appropriates money for those grant programs.
Thank you. Senator Sollman.
Wonderful. Thank you, Chair Dambro, Vice Chair Weber, and members of the committee. For the record, I'm Janine Sollman. I'm the state senator for Senate District 15, which includes areas of Forest Grove, Cornelius, Hillsborough, and the Rock Creek area of Washington County. We are calling Senate Bill 549 the School Health Crisis Response Act. And as a former school board member, I have to tell you that is exactly spot on. We have a crisis in our schools. Attendance is down in many districts. Disciplinary action is up. Anxiety and depression are off the charts. And teen girls in particular are being hit especially hard, with 1 in 3 girls now expressing thoughts of despair, depression, or suicide ideation. This is a national trend. This isn't just an Oregon issue, but other states have, to one extent or another, been working to get ahead of this. We have got to act, and this is the one bill in the legislature that addresses these issues head on. In Oregon, we got a little bit of a late start. We've cut school nurses due to budget cuts. We've cut school counselors and school social workers. The one area of hope has been our school-based health centers. In 2007, in 13, in 15, in 17, in 19, and in 21, this legislature has provided planning grants to 10 school districts to bring their communities together, to put a business model together and launch a school-based health center. As a result, Oregon has nearly tripled the number of school-based health centers from 31 to almost 90. And since each healthcare center leverages state funding 4-to-1, for these 60 new health centers, that means that our districts bring in an additional $23 million each biennium from private insurance, Medicaid funding, and grants. That's an amazing return on investment. In the last 2 bienniums, we have adjusted the model to pilot mobile health centers, expanded the model to be more responsive to our small rural districts, and also to pilot the use of telehealth, which holds the potential of unlocking millions more to pay for school nursing services. The point of this is to draw those funds in that means instead of out of our classroom dollars. A key point to each school-based health center is each of them are slightly different. The school district uses the planning grant process to engage in the community, identify a medical sponsor, and build a solid business plan and relationship. For instance, my district in Hillsborough went through the 2-year process and now has several centers that meet the medical and mental needs of students right on campus. In this bill, we're also granting the opportunity for school districts to incorporate other tools which have been successful in earlier legislatively funded pilots. For instance, trauma-informed schools and community wraparound services. These programs move the needle for kids and help us address the school health crisis. Finally, I urge the committee to not forget Senate Bill 552, an idea that came from Representative Dexter, which we built into this duo of bills to be more efficient by building 10 modular school-based health centers at once that districts could then drop into their school properties as soon as the planning process is complete. This would be quicker, cheaper, and more efficient way to get new health centers in place. I am so incredibly excited about this bill. I have seen what promising action that our school-based health center has done in the Hillsborough School District, and it represents so many years of work and involvement on the issue. I think that we have seen what the pandemic and COVID has done for our students. I think that we have heard when our legislators took the road tour and heard from every corner of the state how incredibly important mental health support and trauma-informed care was to their success. The panels you are about to hear from are experts and include over 50 organizations during the development process. This is critically needed across our states, and I urge you to support this bill, not only because of that return on investment, if that's what you're looking at for making sure that we're working and using our building dollars efficiently, but this is about our kids, and these are about our students and how we can better support them so that they can perform better academically. Thank you, colleagues.
Thank you, Senator. Doug?
Great. Mr. Chairman, members of the committee, vice chairs, I really appreciate the opportunity here, and I'm going to be fairly brief. A lot of what I would have said has already been said by Senator Sollman, and I really want you to hear from the witnesses that are going to come after me. I do want to make just a couple quick points, if I could. Advance the slide here. I think something Senator Sollman mentioned was really important, which is it is the legislature which has driven the increase in the number of SBACs in the last 15 years. And that's happened on a regular basis in biennium after biennium. And why is that? That's really for two reasons. The first reason is the fact that they leverage money. So you can put $1 into a school-based health center and you create $4 or $4.50 or $5 in funding for a school district to meet the health needs. So they're an excellent economic return on the investment. They do so by leveraging Medicaid and private insurance and also drawing down grants and community support. And the second reason is the research. The research is very clear on a national level and on a state level, the amazing impact that this provides. So here we are in 2023, and we've seen the articles. In fact, I was listening to the national news yesterday talking about teen girls' depression, anxiety, suicide ideation being way up, not just in Oregon, but nationally. And these are some of the statistics that the senator referred to. But it's a crisis. As a father of 3 girls, including a 19-year-old at University of Oregon, I watched what she went through with the COVID period of time. I've seen what her friends went through. And I will tell you that it is absolutely essential that we have the resources to be able to respond to these youth, girls, boys, our entire system. And if you take a look at the research in Oregon, what you see is when we combine, and as we do in this bill, school-based health centers with trauma-informed schools, which involves everyone in the school system. The last panel testifying about the importance of the bus drivers, the cafeteria workers, the classified personnel. That's what a trauma-informed school does. It enlists all the people who surround the youth in this trauma-informed approach. And the numbers were just incredible. This is a program that the legislature passed, but in just 1 year in the 2 pilot projects, algebra failure rates dropped dramatically, biology failure rates dropped dramatically, disciplinary referrals, which are a key indicator of success, dropped amazingly, absenteeism rates went down just in 1 year, and that was just the first year of the program. So it really is an opportunity to make a difference in these youth's lives. I'm not going to dwell on these slides, but what you'll see is I've summarized in OLIS, and you can take a look at them, that starting in 2007, when we had 31 school-based health centers, we had gaps and we had problems with the way the system worked. We did not bill electronically. We did not keep electronic medical records. And as a result, we were missing out on opportunities. We didn't have good community planning efforts, so we didn't involve and engage the community in the planning process. We fixed that and over the years expanded the model to make it much more responsive to the needs of youth in school districts. So you can look through this and you can see the various bills. You can see many of your colleagues on a bipartisan basis have been supportive of the bills over the years, very proud of all these bills. And the bottom line here at the very end of the slide is today we have, as Senator Sollman mentioned, close to 90 school-based health centers that will be in operation in the fall. We have mobile health centers that are being piloted, one of Senator Sollman's efforts a couple years ago. We have telehealth, which brings the opportunity potentially to be able to bill school nursing services through an SBHC, which is really exciting. And 100% now have electronic billing and electronic medical records and mental health capacity. So I'm very excited to be here. The experts are really behind me. I'm excited about the coalition. These two bills are really exciting. We hope that you'll consider them and send them down to Ways and Means at your earliest convenience. Thank you.
Thank you very much, Doug.
Oh, Mr. Chair, could I mention one fact? And that's that Representative Dexter texted me. She was unable to be here, but she wanted me to make sure you took a look at her testimony, and she wanted me to make sure that I referred to her with capital letters, extreme support, capital letters, extreme support for the bills, and asked the committee to take a look at her testimony in OLIS, which is excellent. Thank you.
Thank you very much. And let me just quickly ask, we are considering amending this second bill into this bill just for time purposes, so we don't have to have a public hearing. Are you okay with that choice?
All in favor, say aye. Aye.
Okay, great, thank you.
Thank you.
Efficiency.
We've already put in the request, so
Efficiency.
I'm glad to hear you
Just
say you
like our
like it.
school-based health centers deliver. Efficiency.
Okay, thank you.
Thank you.
Okay, next, can we hear from Maureen Hinman? And,
They want the students next.
yeah, that's great. Maureen, are you remote or are you here? Oh, you're here.
I'm here.
Thank
Is
you.
it okay if the students?
And
come
the
up here with
students, sure, come on up at the same time. Thank you very much, all of you, for coming.
me? Thanks. Okay, Chair Denbrough, Vice Chair Weber, I'm Maureen Hinman. I'm the Executive Director of the Oregon School-Based Health Alliance, and I'm here in support of SB 549. This bill is I'm gonna make sure I can go. This bill is a comprehensive and equity-focused whole child approach to addressing the mental health crisis that Oregon youth are experiencing. This crisis is creating multiple barriers to students accessing and fully engaging in their education. Over the last couple of years, we've worked with over a dozen school communities supporting their school health planning processes. We've looked at data and heard from parents, students, staff, and community partners all across the state. I personally have been doing this work for 12 years, and this is the first time that I have heard every community and every demographic within the community agree on the priority, and that is mental health. They need mental health services. Their stories were the impetus for us to create a coalition where over 90 people from multiple sectors met over the course of 4 months to work on the language, and that included youth as well. So I'm going to try to describe the pieces of the bill really quickly because there were multiple sections. So sections 1 and 2 are asking for an inflationary increase for school-based health centers because their funding has essentially stayed flat despite an annual 3.5% state cost rate increase and massive inflation in the last few years. Sections 3 and 4 are asking for grants that are awarded to school districts to do the school health planning process that was just described, which includes community engagement, a needs assessment, working with community partners, and really pulling together the community. And then districts now have the flexibility of choosing a school-based health center or a school nurse model, building that system, or a school-based mental health model. Sections 5 and 6 are asking for an increase in school-based mental health funding for school-based health centers and for schools that don't have school-based health centers, because only 25% of districts have school-based health centers in Oregon. Sounds like we have a lot when you say 90, but it's not a lot compared to the number of schools. And school-based health centers, there's data on this slide that I won't read, but really demonstrates the impact that they have on supporting students' mental health and improving outcomes. So sections 7 and 8 are grants for wraparound service delivery hubs that are based in schools. And we are asking for 10 grants for consortiums that include a school district, community partners, parents, students, and staff. These consortiums will work collaboratively to develop community-driven, trauma-informed services that will be provided at the school. And I want to point out that these grants are seed money to develop the infrastructure for a community-based collaborative effort They won't fund the whole system, of course, but instead they really will provide communities with the capacity to leverage existing resources more efficiently. Trauma-informed schools and community schools have shown improvements in academic and behavioral metrics. And the stunning cost-benefit research suggests a return on investment of up to $15 for every dollar invested in social value and economic benefits. And the frameworks also align with ESSA provisions and with the ODE student investment account guidance. Additionally, the Federal Department of Education has called for an investment in community schools, so this grant will set Oregon communities up to apply for federal funding, so another place to leverage. In sum, this bill provides evidence-based supports, is flexible to meet the needs of diverse communities statewide, and leverages resources to the maximum benefit of the community and the state. We need to listen to our young people and their families and invest in creating these wraparound services. So I urge you to vote yes on SB 549.
Thank you very much, Ms. Inman. Okay, so Katie, Zoe, who wants to go first?
Hi. Chair Denbrough, Vice Chair Weber, and members of the community committee. My name is Katie Gregg, and I am a student at Catlin Gable High School. Coming back to school after online learning, I've noticed that youth are more anxious, stressed, and depressed than ever. The world has changed, and it's important that schools adapt to handle the effects years of isolation and a deadly virus has had on its students, meaning creating a safe, comprehensive, accessible environment in which students can receive the help that they need. I've experienced mental health challenges, and with COVID and starting high school, I found that the anxiety and stress that I felt amplified. Currently, I have the privilege of receiving the help that I require to thrive and perform to the best of my abilities, both academically and socially. However, this is not the case for many students in Oregon, specifically students of marginalized groups. School-based health centers have been long relied on for regular health services to youth, such as mental and physical health care, along with dental and substance use prevention and treatment services. School-based health centers provide accessible and affordable care for everyone. Success in a young person's life starts with their health and their safety, which isn't possible without health care. SB 549 addresses the problems that I and many other youth are saying is relevant right now. That's why I urge you to please pass SB 549. Thank you.
Thank you very much. Okay, Zoe.
Thank you. Chair Denbrough, Vice Chair Weber, and members of the committee, my name is Zoe McKnight, and I'm a student at San Barlow High School. In the beginning of 2022, I experienced severe mental health issues. My grades dropped, my health declined, and overall, it was a really scary experience. I had to advocate for myself extensively to get the support that I needed. But, sorry, a second. Okay. From calling insurance to figuring out what classes I could miss and still somehow catch up, I shouldn't have had to advocate for myself that hard for services that were keeping me alive. I'm open about my experience with mental health, and there are way too many people around me that have shared that they relate, but they don't know how to advocate for themselves. They can't afford therapy, they can't go to the weekly appointments, or they're dealing with one of the many other barriers to healthcare. If I didn't know how to advocate for myself, I likely wouldn't be here today. My support system and ability to access therapy shouldn't be a privilege. Recently, I got to participate in the school health planning process. Gresham Barlow School District being able to use a grant to build a school-based health center meant that I got to directly advocate for student health in my district, and it gave myself and other students a place to share our ideas and concerns. Youth shouldn't have to navigate the complex healthcare system and all the barriers that come with it, and with Senate Bill 549, we wouldn't have to. These issues need to be addressed. Please pass Senate Bill 549.
Thank you very much, Zoe. Thank you, all three of you. for coming forward. Okay, I'm going to call up the courageous Lori Sattenspiel, please. And then we have a couple of people who are remote.
And when Wyckoff gets back, he's gonna.
Exactly. Senator Dembro, Vice Chair Weber, I'm here in support of 549 and 552. That's the funding piece that's sitting in Ways and Means. OSBA's been involved, probably not as involved as all the experts. I asked Doug, I said, how far are the experts in the back of the room? So we want to work and support and expand the student-based health center model we've been wanting to expand it, sorry. Our districts have welcomed the opportunity to use the model to meet the health needs of our students, as demonstrated by almost 90 that now have student-based health centers. I think the model needs to grow. I just want to reiterate a few key points to the model. It's community and district-driven with engagement from day one. Ability to leverage non-educational dollars, probably one of the most important, and it's become more flexible. Districts can propose the traditional full model, or they can propose the school nurse or mental health model. I know, as was mentioned as well, there's a couple of districts, Tigard, Tualatin, and Central, have done trauma-informed schools, and I know they presented in front of the education committees before with some videos of all of the educators, staff, everybody welcoming students. It was really passionate to see. So I welcome the opportunity to bring this bill and economies of scale for the modular student-based health centers that were also mentioned, and that enables more districts, rural and urban, to quickly place these needed sources of mental health support. So thank you.
Thank you very much, Lori. Okay, we have
What? No questions?
we have the three people who are here remotely.